Hey Instagram, it's Dr. Rick, and today's unboxing is on vitamin B1, also known as thiamine. This is a 365 brand, and it is a company that's owned by Whole Foods. And I happened to go there to the Schaumburg store the other day to pick up a plant-based meal, and I was really impressed with certain vitamins to help with mitochondrial deficiency or dysfunction. And I was very impressed by the data on vitamin B1. Now, in medical school, you're given like, I think it's probably 1 week of vitamin lectures, and that's it. So this is the B1. It's really tiny, and this is 100 milligrams each. And I'll show you in the studies that about 200 milligrams a day of oral vitamin B1 should be good enough. So that's the B1. Gonna have to get into the weeds with this one. That's why I have this busy slide, especially if you didn't watch my last video on staying 20. So essentially, these are the chemical things that happen in your body. So this is how it works. 30,000 foot view is that you take your food gets turned into chemicals. Chemicals, when ready in the body, get turned into mechanical energy, and you move and think and you function. Now, when food is broken down into carbohydrates, the carbohydrates broken down into a chemical called glucose. Glucose is right here. And glucose is a powerhouse of possible or potential energy, but you got to break it down. So glucose, by way of 10 different enzymatic processes, is turned into pyruvate. I'm going to finish this real quick, so hang in there. Pyruvate, it does give a little bit of energy, and NADH and pyruvate. But the beauty in human cells, especially when you go aerobic, not anaerobic. So this is anaerobic, doesn't need oxygen, happens in the cytosol, in the area of the cell that's got all the meat in it, not the nucleus. And then when you get pyruvate ready, it can, if you can transform pyruvate, it gets to the Krebs cycle, the TCA cycle. And that's where all the energy comes. A ton of energy can be elicited from glucose if everything works properly. The only problem is, and that's what I'm going to present to you, is there are enzymes. Again, there are 10 enzyme steps in glycolysis. There are also 10 enzyme steps in oxidative phosphorylation. And all these steps, if they're working properly, gives you impact. You can sprint in a 100-yard dash, or you can run from danger. You can think and do an exam. The problem is, those 10 enzymes in glycolysis and those 10 enzymes in the Krebs cycle, if they're not there, or if they're poorly functioning, you're not going to get anything. So imagine if I stopped everybody's energy level here. You would have a ton of energy if you continue on, but I stop it here. If you stop it here, you still have a little bit of energy. Pyruvate can go to lactate, lactic acid. Those of you who exercise, you know most people don't like lactic acid, but it's actually an energy packet. It's a substrate that can be used for energy, but we all know lactic acid has aches and pains. In fact, exercise usually tops off. Even most elite athletes can top off with the lactate threshold. If we go to lactate, you can use this as an energy source. Cancer cells use it as an energy source, so they figured out how to use it. But lactate can go back to the liver in the Cori cycle to produce pyruvate again, and then glucose. So it's called gluconeogenesis. We don't have to get into that, but regardless, this is what happens when you don't have enough thiamine, and I'll show you the studies. Thiamine is involved in this step, and this step. That's why I put them in red. And when you don't have enough thiamine, and you would think in the United States we're okay with thiamine, but I will present to you my argument that we're not. In developing countries, definitely no thiamine or low thiamine. There's studies that are from Laos and other places in Asia where you have beriberi. If you don't know beriberi, it is when you have the onset of symptoms, numbness, tingling, mood changes, autonomic dysfunction, almost mimicking POTS. Difficulty with vision. All these things happen from not having enough vitamin B1. Anyway, this is energy production, and when you don't have energy production, you feel exhausted. And my argument is that the exhausted feeling that we all have now in the United States with COVID and lockdown or if you just have fibromyalgia or chronic fatigue syndrome, I think that, again, the argument that I'm going to bring you is that I think it would be worth it to try vitamin B1. This is that. This is the Krebs cycle and energy in the human. So I refer to thiamine as a linchpin, because if you don't have that linchpin, imagine this, trying to get into your property. You need a linchpin to open the front gate. You need a linchpin to open the garage. You need a linchpin to open the door going into the kitchen. You need a linchpin to open the cupboard. You need a linchpin to open the box where you keep your chocolate, in the cupboard, in the kitchen, going through the garage, going through your property, coming from the street. So if you don't have the linchpin, or if the linchpin guy goes on strike, you're not getting into any of those. So the doors don't open. And that's why I think it's important, if you understand, to have that linchpin available. So the only question is, are there any side effects to the linchpin? And I'm going to prove that to you now. None. So this is the study from my first video on staying 20. And it's pretty good, pretty thick, but it's available online at the NIH's website. So check it out if you're interested, because there are other things I did not talk about in the last video that you might want to take advantage of. So this is from the 2018 Annals, and it essentially showed that there's two ways to measure. I guess we should talk about measurement first. There's whole blood thiamine, and there's something I call EAT-K assay. So don't worry about that. I guess if you're asking your provider to test your B1 levels, it would be important. It's always nice to have data before, data 3 months after, and data 6 months after, as far as am I getting to therapeutic levels or not. But honestly, if you can't afford blood tests, and I don't have medical insurance now, so I certainly can't afford it. But if you can't afford it, then you go old school. You just see how you're doing. But it's kind of hard to see how you're doing in 3 months and 6 months, because most people tap out and say, I'm not getting any benefit from this. There's a study that showed about testing. So that's one option. Again, there's whole blood testing, where you just take your blood and they spin it down and they just see if there's any thiamine. But that could be a problem, especially with my patients, because I tell my patients, stop all vitamins 3 to 5 days before your blood test. And thiamine only sits in the bloodstream for about 12 hours. So, and it sits, not necessarily floats in the bloodstream, but it's carried by your red blood cells. Thus the reason for the second blood test, which is what I call the EAT-K assay. But, you know, that's got to be an expensive test. It's specifically called erythrocyte alpha transketolase assay. And it's very cumbersome. It takes like 60 minutes to run. You have to get somebody's blood. You have to add substrates of the pentose phosphate pathway. I did put it here, pentose phosphate pathway. You have to add substrates there. And if you have, well, again, you don't have to know the details, but it's labor intensive for 60 minutes. Do you imagine paying a lab tech for 60 minutes of work? Anyway, they're valuable, but that's going to be an expensive test compared to just thiamine whole blood levels. So this is just another paper that showed the EAT-K assay is very valuable. Those two studies I just showed you are old. The newer studies use gas chromatography or liquid chromatography to really diagnose, but then you're talking about a very, very expensive machine. Again, you can get really anal retentive or obsessive compulsive and want the data, and that's fine if you want to pay the money. But again, hold till the slide, and I'll tell you why. This is another study that shows HPLC or using really fancy machines to test your levels. But do we need those fancy machines? Do we need those levels? It would be nice, unless you don't have insurance. And also, if you can wait and not to make too many changes and document or journal improvement over maybe 3 months, I think it'd be important, because it takes that long. So if you're going to initiate change, like any of my patients, if you're going to initiate change, do it. But if you're just looking for side effects, do not do anything else different for at least 2 weeks. I think that's a fair amount of time. If you don't change your eating, your sleeping, your activities, your exercise, and you just introduce one variable, a new vitamin of some sort, maybe vitamin B1, and for 2 weeks, no side effects, that's cool. That means you're probably going to be okay. But if you wanted to really do an anecdotal study on yourself, subjective improvement, you cannot make any changes, many changes for 3 months at least, because a lot of the studies here at the end show 3 to 6 months of improvement. It just says that there are populations of the world where people are lower on their vitamin B1 levels than usual. But this study was to show that I didn't know why they did it, but I didn't read the entire, I just read the abstract, but they said that doing one blood test and then treating is not as good as doing 2 blood tests over the course of time and then treating. I'm assuming my interpretation of that was most people would stop taking their B1. So would you stop it at 3 months just based on 1 blood test? Or would you continue it into 6 months? And thus the reason why you gotta be patient with this stuff if you're gonna make some changes. This was also pretty decent as far as how much to take, because it's hard to find dosing parameters for vitamin B1. Essentially, this study is pretty good. They looked at Wernicke's encephalopathy. That's from alcoholism. And you guys that drink every day, you got to be careful, because alcohol makes everything in the gut move faster and not get absorbed, because alcohol is an irritant. Yes, it makes you relaxed. It decreases inhibition, kind of settles COVID brain, but at a price that you usually have malabsorption of normal vitamins. So if all those vitamins that are supposed to be absorbed in the small intestine are being flushed out because your small intestine is saying, hey, there's alcohol in here, I'm getting rid of all this crap, you're going to have deficiency. And that's what's called Wernicke's encephalopathy. Anyway, so the study was nice for Wernicke's. It said that there was a dosing challenge that they gave to Wernicke's. Definite Wernicke's encephalopathy diagnosed with blood tests, 1 gram a day, IM, that means through the shot, for 3 to 5 days. And then they gave high dose thereafter for people that were diagnosed. For people that were suspicious of having Wernicke's, they gave a slightly lower initiating dose, IM, for 3 to 5 days, and then they gave them a slightly lower dose orally thereafter. But my thing is, number one, I can't order I probably could order it, but I'm not going to, because I don't feel that I have that many patients that are Wernicke's encephalopathy. That's usually hospitalization or psych ward. So what I do suggest is that if you're high risk, that you do have a drink every day, or you're not taking enough vitamin B1 or B2 or B12 or any of the Bs, or you eat crappy, then you can consider yourself high risk. And again, you don't have to get measurements. I don't think you have to get measurements, and I'm building this argument up. And I don't think there's any side effects, and I'll show you that in a second. But high-risk folks, 500 milligrams a day for like 3 to 5 days. And then thereafter, I think in a nutshell, I do 200 milligrams a day. Why? Because most of the vitamins I checked on Amazon are 100 milligrams. And if you do 2 tablets, that's easy. Doing 250 to 300, that kind of throws off the dosing. So to me, high risk or low risk for possible thiamine deficiency, I would just load with, load with 500 milligrams a day if you can afford it. Again, I'll go through the side effects in a second. 500 milligrams a day with this guy, 365, for 3 to 5 days every day. You can divide that up if you want. And thereafter, I take 2 chewables every day for at least 3 to 6 months and journal your improvements. And I'm going to say right now that you should consider, especially if you're a diabetic. So here we go. With animal studies, they showed that in vitro animal studies reversed or decreased the damage to nerve cell just by giving thiamine in the dish. So again, the nerve cell was damaged because of exposure to AGEs. So that's typical for diabetes. You diabetics who are full-blown and really high hemoglobin A1C, greater than 7, you are, for every spike in glucose during the day, you're making your blood thicker. You're also getting the charred effect to all that extra glucose that's floating around that can't get in until you take your insulin. So those of you who are borderline, just a little bit elevated on the hemoglobin A1C, I think hemoglobin A1C greater than 5.7 and up to 7 to 8, those are the pre-diabetics. You're still having damage. And every time you spike that glucose, if you're having a cigarette, if you're getting irritated because of somebody pissing you off, that's burning all that extra glucose, and you're charring and you're causing AGEs. The higher your AGE, the higher the hemoglobin A1C. For everybody that's got borderline glucose, elevated hemoglobin, every time you get pissed off, every time you have a cigarette, every time you eat bad food, you're going to be cranking up on your hemoglobin A1C. Now, if you lead a healthy life, if you exercise, if you act like you're 20, you're going to lower the hemoglobin A1C. So that's my big sell for the day. But this is another animal study that showed that a nerve conduction in vivo was improved with thiamine. So I can only tell you that it's helpful for suspicious low thiamine. It's helpful for alcohol-induced low thiamine. It's helpful for diabetes. And because of the side effects of low thiamine being almost equal to COVID, especially with regards to no energy production, numbness and tingling, visual issues, mood, I think it would be helpful for COVID. I mean, we don't have anything else for COVID. The vaccines will come in a couple months, but we're still not going to have herd immunity till like this time next year. So why not? So anyway, as far as side effects, this is a pretty decent paper to talk about side effects. And there was note of side effects with a high dose IV, as far as maybe allergy versus ganglionic blocking, as nerve conduction blocking. But that's IV. And number one, I told you I don't have IV. You can kind of induce that with IM or intramuscular, but I don't have that either. So for my practical patients and for me, I just have oral. And I think if you do oral, so the side effects that were detectable orally, none. So there's no side effects orally. Let me just see. This was a study that was produced by Emergency Medicine. So no deleterious side effects at 3 grams per day. 3 grams per day. I'm only suggesting 200 milligrams per day. Two tablets of this stuff. So I think we're safe as far as side effects. But benfotiamine is another form. You'll find this also in Amazon or at Fruitful Yield. But benfotiamine is essentially a fat soluble version of vitamin B1. So in theory, it should get in better. There's another fat soluble one that goes into the brain too, but the problem is you turn essentially a water soluble into a fat soluble. You might be messing around with all the data, because the data is mostly on water soluble. So again, in a nutshell, if you think about it, water soluble you can never go toxic with, because it's water soluble, so you just pee it off. Fat soluble, it gets absorbed and stuck in fat. So vitamin A, D, E, K, that's fat soluble. So theoretically, you can have some toxic levels built up, especially if you have overweight issues, obesity issues. So there's only one caveat with vitamin B6 in the water soluble. Too low of vitamin B6, numbness and tingling, eye problems. Too high of vitamin B6 can sometimes induce the same neuropathy. So those of you who have neuropathy or diabetic neuropathy, you just have to be careful with your vitamin B6. And that you can get a blood test for, pretty decent. But again, I would go focused with B1, 3 to 6 months, no other changes in your vitamins, and see what happens. So benfotiamine, again, side effects, nothing. If you want more energy, if you want to get past the blockades where pyruvate dehydrogenase is blocked, alpha ketoglutarate is blocked, trans ketolase is blocked, just doing B1, fixing your linchpin deficiency might provide you some pretty decent results. Because there's low side effects, again, just as a summary, I would load up with 500 milligrams orally every day for 5 days, and then I'd back down. So 500 milligrams for 5 days, and then back down to 200 milligrams thereafter for 3 to 6 months. Now, just as a disclaimer, this is not meant to be a substitute for medical advice. Take this information to your doctor. If you're one of my patients, get back to me and I'll discuss it with you, because you might have other things we have to work on first. But if you fix the linchpin, you should have some pretty decent results. If you have diabetes, even if your linchpins are okay, if you have diabetes and you're on medicines, you should be able to fix or get better results, especially with your every 3 to 4 month hemoglobin A1C. Risk to benefit ratio. There essentially isn't any risk if you go with oral. If you happen to get the IV, you might have to have an issue. But if you go with oral, no risk, benefit, high benefit, I think it's a win-win. So I'd suggest, bottom line is that this should be added, especially if you have any of the symptoms I just went through, or problems I just went through, or you're getting through COVID. I would add that as soon as possible. So hopefully this gives you a couple of ideas on how to take advantage of this B1 supplement. If you have any questions, or if you have a B1 supplement you like, please put them in the comments down below. And otherwise, don't forget to subscribe, like, and share. It's a little bitter. FYI, this is chewable. This is methylated B12 folate. This is not chewable. That was why it was bitter. So excuse my facial expression, but do not chew this. Just take the tablet, swallow it. They're pretty small, as I showed you. This is chewable, so you're fine. So anyway, have a good day.